reducing whatever it is that you think triggers your hot flash and doing a little bit of investigative work, writing things down, paying attention, you'll figure out what is it that's triggering.
If you want to live like you matter, ditch the pills, look great, and feel freaking amazing, you're in the right place. I'm Dr. Wendy Trudeau.
And I'm Dr. Ed Levitan. Welcome to the Feel Freaking Amazing podcast,
where we empower you to live a vibrant and healthy life by optimizing your structural, chemical, emotional, social, and spiritual lives.
Hold on to your hats.
Welcome to the Feel Freaking Amazing podcast. I'm Dr. Wendy Trudeau. This is Dr. Ed Levitan. He's with us today. And our guest today is Zora Benhamou. She is a gerontologist on a mission to disrupt the menopause stigma and ageist stereotypes. She's the host of Hack My Age podcast, and it focuses on biohacking for women going through the menopausal transition. So this is near and dear to my heart because I just went through the menopausal transition, and that's why we're going to write our next book.
Me too.
He did, right? He lived through it. So first off, Zora, welcome. And let's give some women some practical tips, because I think there's a lot of things that people can do, even if we don't know whether we're fixing your adrenals, your thyroid, your stress, your gut. We're going to fix all of it, right? So what are some of the top things that women can do? You know, like the 80-20 rule, right? What's the 80% of stuff they can do without a doctor, and then the 20% of stuff they need to do with a provider? Let's separate out. Let's do the 80% they can do on their own.
Yeah, I think I'm a big fan of the 80% because it's so much that we can do for free. And one of my favorite tips is exercise and movement, any kind of movement. It doesn't have to be in a gym, but I'm an athletic person, so I tend to be a bit more biased on that side. But all the research that I see, it's so wonderful what exercise can do, not only for menopause, but just for longevity, to age really well. But regular exercise, and I want to, say 5 times a week or move every day. It depends on how, I'm not saying to kill yourself. I'm just saying there are times we need to increase our heart rate, and there's times that we need to recover, and there's times that we need to get strength and flexibility, mobility, agility. All these things are really, really important. Just really want the audience to start moving. And that's going to be different for everybody. If you've been sedentary, then, just walking is going to be a really big step towards that direction. But if you've been running or been moving around for a while, then learning how to exercise appropriately is really important, because what athletic women tend to do is overdo it. And we don't recover as fast as we used to. We expect, we like to push it hard, and it's just not working, this sort of chronic cardio that, a lot of women have been doing in this space. Because if you grew up in the 80s, you've been running and on the bike and trying to do as much cardio as you can to burn the fat. And this is, old news now. We hopefully, most women are now understanding that we need to lift heavy and some strength training. And of course, the HIIT, high intensity interval training, is really good because it gets your heart rate up, but then it brings you right down. But really important is the recovery component, which is really hard for women who are athletic to get into that mode. But it helps your insulin sensitivity when you exercise regularly. It manages the body fat, and the hormones are better balanced. You get better sleep, fewer mood swings. All of this is so good for you. I mean, the transition will be a lot easier, not only through menopause, but transition into older age as well. Just being active and being independent. What does an older adult want? Independence. We don't want to be a burden on our family, and live, age in place, age in home, and not have to go to a nursing home. If you do, then it really start lifting heavy and start exercising or start walking, whatever that means to you. Just please move. That's my number one tip.
Everything's better than nothing. I always think about that, because I'm like, oh, I don't have time to do a full workout at the gym. I'm like, well, let's do half a workout, right? It's better to do some than not to do any. That all or nothing mentality is where we get really nailed. So anything is better than nothing. That's what I would say.
But I want to add to that, because a lot of people I interview on the podcast who are in this, fitness space and menopause, and they say, walking and yoga is great, but it's not going to be good enough to protect you from osteoporosis. We need a little bit more impact. And that doesn't mean you have to go crazy, but just jumping on a box, from the floor. It's you don't have to, beat yourself up by running every day, and we wouldn't want you to do that. But giving a little bit of plyometrics would be a really good thing. So I really want to remind women that for osteoporosis particularly, we want to be able to get a little bit of impact in there.
Mm-hmm.
Absolutely. And I think people don't quite understand that bones are like muscles. If you don't put strain on them, they're going to disintegrate. So putting strain on bones is super important. Not too much, but a little bit. And women are also, I think, from what I sense, it's Alzheimer's and osteoporosis are kind of the two biggest worries that a lot of my patients come to. And and I can put them on hormones, and I can get rid of the toxins. I can do this, that, the other thing. And that's all amazing. It's appropriate. But if they don't exercise, that's like more than 50% of what they need. They're not doing the main thing. And then they want all the biohacking
foundational, right?
Cool, right. But it's you got to exercise. You got to move your body.
Foundations first.
Yeah.
All right. What else? So move your body's one. What else?
So the next one I would say is the big one, is really big one, is managing the stress. And that kind of goes with managing the stress, not only the mental stress, but the physical stress. And let's say toxic load, especially, everything that you speak about is super important. But because like I mentioned before, stress is not going away. We got to manage it. So I'm a certified breathwork instructor with the Oxygen Advantage. I'm so happy I did this, and I'm able to teach women how to breathe, like functional breathing. This is the way we breathe all throughout the day, while we're exercising, while we're sleeping, right? Not just that 1 hour breathwork class that you did in yoga. That's really nice, and it's a great technique. But I really want women to learn how to breathe, because it helps. It's like an immediate fix for a stress, or when you're feeling overwhelmed, or if you wake up in the middle of the night and you can't fall asleep again. I don't want our women to pick up the phone when 2 a.m. and start scrolling and trying to fall asleep that way. It's not going to work. And so I really encourage them to learn a breathing technique. There's so many out there. And then practice this while you're trying to fall asleep again. And it really, really works. And it also alleviates some triggers for hot flashes. So some women say stress can trigger their hot flashes. So, again, breath work is great, but anything that will manage the stress. And in the biohacking world, we love gadgets like a new calm, for example. It's like this neuroacoustic software that you can listen to, and it's supposed to get your brain into a meditative state, because meditation is not easy for everybody. I could say that, and it's great. If you can do it, fabulous. If not, then it's nice to have these little tools or gadgets and things that can help us calm down and relax immediately. But the breath for me is like, wow, that's free, and we just have to learn how to do it. And then when you're able to breathe, you're obviously getting better sleep. You're performing better if you're exercising. You're able to go up a flight of stairs much easier. And so I really am a big fan of the breath work, but that's for the mental stress. But it does have obviously a physical impact when you start breathing and learning how to breathe. Your heart rate goes down, and the blood pressure goes down, and immune system is better. Everything functions much better when you're able to manage the stress. But the toxic load as well, toxic stress, and everything that you preach as well in terms of figuring out if you have mold toxicity, heavy metal toxicity, the EMFs as well in the environment. But I also love to talk about toxic people and try to get those people under control in your life. And they're a toxic load. If you feel you're obligated to be with these people, or you bend over backwards for them, and it takes a big impact mentally and physically on your life. So managing the stress is a real big one.
Anything about breath work you want to add? I know that she's talking your language.
No, I mean,
I took a deep breath when you said breath work. I was like, okay, I need to breathe.
I mean, just like exercise, breathing will move the lymph nodes, massage the internal organs, give you more oxygen. There's exercise, there's meditation, there's breath work. Everybody needs to, not needs, but the recommendation is to really move that part of your body. because exercise does not do that enough, and most of us breathe from the top up.
Yeah. All right. So breathing, movement. What else? What else isn't that 80% people can do?
Yeah, when it comes to the typical hot flashes, let's say, because and night sweats, this is really something that women struggle with is reducing some of the caffeine, alcohol, spicy foods, whatever it is that you think triggers your hot flash, and doing a little bit of investigative work, writing things down, paying attention. You'll figure out what is it that's triggering. And oftentimes, women don't realize the caffeine, especially if your adrenals have been overtaxed and you're already, in a stress state, trying to stay awake and getting dependent on coffee or caffeine is it's not something I recommend. So, there's so many ways we can just kind of reduce it in our lives. And I love using, mushroom, like chaga, adding some day Four Sigmatic, I think is one of those brands that people like out in the US. And then making maybe a golden milk with a lot of spices and turmeric and cinnamon. There's a lot of, alternatives out there to having a nice warm drink in the morning. Obviously tea, herbal teas is there, but sometimes people are just bored with that and they want something else. And if you just Google it, you'll find a lot of alternatives to your morning coffee, and not that you have to take it away. One thing I really don't like to do with my clients when I'm working with them, when I find out that coffee, that ritual is so important. They love that. So I don't want to remove that joy, because we need vitamin J, right? That's important. But just if you're overdoing it, if you find you're dependent on it and you think that it's triggering your hot flashes, then you may want to just manage that a little bit too. You
can have the ritual without the coffee. You can change it up, right? Sit, do your I do the crossword puzzle every morning. So do the crossword puzzle, read the paper, whatever that ritual is, it can occur with a different drink. Like I'm drinking chicken soup.
Are you?
I'm sure people think I'm drinking coffee, but I'm drinking chicken soup.
Or bone broth.
That's what I'm drinking is bone broth. Bone broth with collagen and salt.
I mean, the other one I know I've gone in and out of is mud water. It's a blend of adaptogenic mushrooms and a little bit of caffeine from tea.
Oh, okay. That's interesting. Is that a brand, or is that just what people call it?
It's a brand.
Oh, okay. Interesting. Yeah, we don't have that in Europe.
Mud, WTR.
Yeah, .com or something.
Yeah.
Interesting. Oh, I have to go look that up.
Any other major things that fall in that 80% category that we want to make sure women know about?
I want to stress the importance of intimacy. I think investing in your relationships, in your partner, connecting with your partners, taking care of your vagina, if I can say that word, and having that good vaginal health, whether it's with estriol or lubricants or other things, or just having plenty of sex, that is really important. And we tend to, and I totally get it, when you're in menopause and you got low libido and your vagina is dry and it hurts to have sex, and it's the last thing on your mind. But we don't prioritize it enough. And I really don't like women to brush it aside and say, whatever, I don't need it. I think it's important to pay attention to it, whether you're with a partner or without a partner. If you're with a partner, ask your partner if he or she is okay with that. Usually not. But if you're alone as well, you got to figure out a way to self-pleasure is very important, but to stimulate the vagina for those juices to come in and have a very healthy vagina. And you know more about this than I do in terms of what you recommend to your patients. But it is something I really want women to not ignore and put aside. I think life is so much more rich when you have that intimacy, whether it's with yourself or with another partner, and you'll probably be happier. And then all of this sort of cascades in a very positive way.
Here's the best thing that Amazon has provided women. Okay. Ed, you probably don't even think about this. Brace yourself. I know you can tell it's coming. So you can get dilators on Amazon now. And that's literally the best best thing that we've ever been able to approach this, because I can now say to people, just go on Amazon and buy dilators if your vagina has gotten too inelastic and it can't tolerate either fingers or penis or sex toys or whatever. You can get dilators. And so that with a lubricant and maybe some vaginal estrogen, that can actually transform the tissue. And so, but you do need to use it or lose it and retrain it to be more elastic. So I say to patients, get a dilator and then go just slightly bigger than what's comfortable, whatever that is. Start wherever you are and then just keep going until you get to the point where you feel like you're in the right place. And it's, practice makes perfect. So it doesn't happen overnight. Did you know that you can get dilators off Amazon? Now you know.
I will leave that conversation to you.
Yeah. Go see Wendy. She wants to talk to you about something.
Hello.
Seriously, you see a lot of women.
I see a lot of
and they tell you everything. Sometimes I'm like, oh my God, I can't believe they're talking to you. They tell you everything. So
you're making them feel comfortable. That's really good.
He's like approachable. So yeah, now you know, dilators on Amazon.
Super important. And there's so many other things too, just little toys, whatever. Red light, they got stuff with red lights in there and rejuvenation. Yeah.
There's a red light wand now.
That's cool.
And up the hatch. Okay. Any other tests you recommend for women to do?
Yes. I think every single woman who is listening right now needs to do a bone density test. Unfortunately, I think in the US, it's the age 65 when Medicare pays for it, or something way too late. Way too late.
People go on to Medicare at 65. So that's when they're eligible for Medicare. But long before that, they should be having a bone density.
They should be, but I think a lot of women don't because, well, either they don't know, the doctors are not recommending it, and by then it's really too late. So I really think it's very important to have a bone density test, first of all.
As a baseline.
As a baseline. And then from there, whether you need it every year, every couple of years, whatever, that's depending on the results. You may need it every 6 months if you're seeing you're already quite fragile. We want to make sure we also have, I would say thyroid is also a really good test to do, just because I see so many women in perimenopause having thyroid issues and not really knowing it. But also you know more than anyone else, and is getting not only your TSH, that's seems to me every doctor here as well in Europe is in the US. It's just TSH, thyroid stimulating hormone. And if it's fine, you're fine. And even if you feel bad, they just still send you home. So I really want women to.
You're fine. It's no problem.
Yeah, everything's just.
You're just an anxious woman.
It's all in your head, actually.
Here's some antidepressants and a sleeping pill. You'll be fine. And it's really a pity. So we want a full thyroid panel, the T3, the T4, the reverse T3, and then of course if that comes out, then the anti-TPOs, and just taking a full deeper dive into thyroid, I think is really important. Insulin. Seeing your insulin levels, where that's at, because that's it. Generally, women going through perimenopause and getting to menopause, they have a lot of insulin resistance. They don't know why they can't eat like they used to. Nothing's changed, and they haven't changed their diet, haven't changed exercise. Everything's the same, and they're gaining weight, and it's really stressful. So many women I speak to, they swear everything is the same, and it's frustrating because what I see is that they're exercising more and eating less. And that's the worst combination because they tend to just doesn't do anything anymore at our age. And maybe it worked when you were in our 20s and 30s, but it's not working anymore. And so I really encourage women, first of all, take your insulin, just see where it's at. We want to know it's in a good, healthy space. And if not, we can work on it. And then, of course, there's so many hacks and things that we can do to deal with the weight gain and the insulin resistance. So those are just a few tests, I think, that are really important. Cholesterol as well, because cardiovascular disease gets thrown right under the rug. Women are more worried about breast cancer than heart disease, but we're dying more of heart disease. And I think we really need to take a full cholesterol panel. I like women to do the ApoB as well, not just HDL and LDL. In total cholesterol, we could take a little bit deeper dive, and there's so many other things that you can do. I don't know if you guys do the MPO, the oxidized LDLs.
No, we don't. Well, we do.
We're doing the cardio IQ.
The cardio IQ, which is what exactly?
It's got the particle numbers and the small, medium, large, and the HDL and the apolipoprotein B and lipoprotein A and ApoE. So it has all of the measures pulled out as well as inflammation. So I love it.
Yeah.
And then I would say a cortisol test to see like what's going, but not blood, because someone with a needle, their cortisol is going to go up anyway. So
yeah. Yeah, I think it definitely cortisol. Those are, we could go down a whole, I love doing blood work, and I do it when I'm in Asia because it's so inexpensive. I'm like, let's just do it all and see what happens. But yeah, no, those are the important ones. I think a lot of women don't realize that just for aging as well, it's not just menopause.
You forgot one big thing though.
Which one?
Vitamin D.
Oh, vitamin D. Yeah, of course.
I mean, you can't.
I was like, what are we talking about?
Yeah. So
no, I mean,
yeah.
The vitamin D is still important in making sure it's, at least in the US, it's optimally at 50 to 80 to really, when you're looking at menopause, making sure, because that's for the woman that it's much more important. That's where you're going to get more. It's more important than calcium, because if you have a good level of vitamin D, that's going to help you absorb the calcium. And you need much less calcium in your diet. So super important to have.
I was talking to someone yesterday or some earlier this week about, she's got osteoporosis, she's menopausal. And she said to me, yeah, I was having some reflux. So I took Pepsid. And I was like, oh, let's not do that. And she was like, why? I said, because so your stomach acid's required in order to start the conversion for calcium, magnesium, folate, B12, and iron. It gets converted in your stomach acid, and then the small intestine, large intestine absorb it, small intestine. And so if you're not starting the conversion process, you don't get the activated forms of them, and then you can't absorb them. So don't take Pepsid, pantoprazole, all of the acid inhibiting substances mess up your absorption. And so don't do that if possible. Do other stuff, like mastic gum, do other things. But
yeah, once or twice, it's not a big deal.
But ongoingly,
it's a problem. But
once a quarter, who cares? But this was not once a quarter. This was like 4 or 5 times a week. I'm like, you want to tip the scales towards health, not away from health. So yeah.
Anytime you're taking some kind of medicine 4 times a week for a condition that perhaps could be reversed, then it's time. But I'm glad you mentioned the vitamin D. And I think what biohackers would love to do is, again, another great test is we test our vitamin D. We take a vitamin D capsule and we retest in several months to see if that vitamin's working, because there's so many vitamins out there that don't actually have what they're on the label, or you're just not absorbing it, and for one reason or another. And then oh, I got to up my dose. And then you up the dosage until you're happy with the ranges. But I want to ask you, because Dr. David Rosensweet, who did this menopause method program, which I just went through, he talked to me about when he looked at my vitamin D levels, he says, well, we don't really know if your vitamin D levels are actually high. And I said, what do you mean? He said, you have to look at parathyroid hormone. And I didn't quite get the memo on why or how, but there is something in the functional medicine space, because he's a functional medicine doctor, and he said that, looking at the parathyroid, those levels need to be optimized in order to see if you really are absorbing the vitamin D, despite what the vitamin D says in the blood work.
There's all sorts of, I've heard of it. There's also looking at, normally we look at 25 hydroxy vitamin D, and there's all sorts of things about looking at the 125 hydroxy vitamin D, and we don't tend to get into that too much. We do look at things like N-telopeptide, which is how much calcium you're actually leaching, both in the urine and the blood. But we don't tend to look at that. But we can't. We usually find 5,000 is a good maintenance dose, but women that have vitamin D receptor SNP, small nucleotide polymorphism, tend to be able to need like 10,000 a day. So there's all sorts of like really deep dives you can get into. I think we go on one path. There's a lot of other paths we can go to, but we tend to stick with that
I
path.
think we're more at the 10,000-foot view. Like, let's take. I mean,
get deep,
we get deeper,
but not in the like.
Yeah, not every path. So
yeah, it's that's why I said it's kind of like you need a good investigator to understand the whole blood work, because even if you just go, oh, I'm in the ranges, whatever the labs show you, you guys are the experts in tying it all together and saying, you know what, this is something to worry about, or this is not something to worry about. And this is why women going through menopause really need a good doctor, because I think, like you mentioned earlier, they're just being gaslit and they're feeling bad, and their blood work is showing they're just fine.
all right. And I think the most important question is, as we draw to a close, where can women find you?
hackmyage.com is the website, and all my social media, TikTok, Instagram, Facebook, they're all Hack My Age. So if you can remember Hack My Age, then you're good.
All right, then. And I know you would, I think, offered that the people who listen to the Feel Freaking Amazing podcast, they participate in a menopause program with you. They can get 10% off by mentioning the Feel Freaking Amazing code. Is that accurate?
Yes, Feel Freaking Amazing, which is with a G, freaking, not freaking, right? Amazing for 10% off any of our menopause programs. And if you have any questions about it, you just reach out to me, and I'm happy to explain. But these programs are really great. It helps a lot of women get through this transition with ease, with grace, and with strength. I really want women to be strong through this period of time and be empowered with knowledge and how to go find a doctor and how to go find help and how to my motto is menopause is inevitable, but suffering is optional.
Nice. Really nice. All right, then. Zora, thank you for joining us. Thank you for talking about menopause and shedding light on this. And thanks for being here for another episode of the Feel Freaking Amazing podcast. All the people listening, she has her own podcast, Hack My Age. You can certainly go listen to that and have an amazing day. Thanks for being here, Zora.
Thank you so much for having me.
Inspire and empower someone else by leaving a 5-star review.
so they can transform their lives too.